that displays our special education eligibility determination, and there are 3 tier levels for which our student population should lie in. At the level tier 1, this is your benchmark area, and we would like for 80% of our students to receive or be able to be proficient at tier 1 level. What that means is all students who receive instruction in this level are effective and they are receiving scientifically based core curriculum content knowledge. At tier level 2, our student population should be at 15%, and this is our strategic level where students who are not or who do not respond adequately to core curriculum, they are continued and consistently considered at risk for academic failure. Supplements and instructions should be provided to students at level tier 2. At tier 3, students are intensive, and this is 5% of our student population. And at tier 3, students did not respond well to tier levels 1 and tier levels 2, so they were promoted or extended to level 3. These students are provided with more extensive interventions and progress monitoring to make sure that they achieve academically. Now, what I must explain to you is who are the collaborative staff that works for RTI or that assist our students with RTI. You must have a collaboration from your district office administrators, school administrators, which includes principals and assistant principals, curriculum coaches, reading coaches, counselors, teachers, and paraprofessionals. Database documentation. As you can see, this chart pretty much tells us that if we prepare our teachers, our leaders, and we implement or create conditions for success, high-quality schools will be the outcome of both of these 2 targets. Database documentation. Systematic assessments that include documentation at Woodlawn High School. First of all, the Alabama High School graduation exam. We disaggregate the data that's sent to monitor and intervene on the progress of how our students achieved at that level. ThinkLink assessments. DIBELS, which is the dynamic indicators of basic early literacy skills. And last, STAR program. This is a standardized testing and reporting program that we use on our special needs kids to assess what levels they are achieving academically. Now, parental involvement documentation. Of course, teachers must possess documentation to involve parents, and they would include emails, parent letters, sign-in sheets, agendas, conference sheets, telephone logs, newsletters, and school websites. How collaboration starts. First, how can schools implement RTI? Schools may implement RTI by developing a plan, also reallocating some resources to support RTI. Engage and build support among stakeholders throughout their planning. Design a program evaluation method. Purchase valid and reliable screening and progress monitoring tools that will culturally and linguistically be responsive to their students' learning needs. Create and purchase evidence-based curriculums. Review the vision, framework, and goals as necessary for RTI. Lastly, schools can create policies, procedures, and guidance that supports RTI, provide ongoing professional development for teachers, and perform intervention audits of RTI. Lastly, schools may conduct evaluations of progress in preparing for RTI implementation. Next, how can teachers implement RTI? Teachers can implement RTI by providing early counseling interventions and referrals. Once teachers identify the students and their learning needs, that needs to be reported. Teachers can critically or use critical thinking skills and collaborate among their school personnel to identify our students. How can parents implement RTI? Parents can advocate for their children. Also ask questions frequently as possible so that they understand RTI. Know their rights as they pertain to monitor and progress data, actively support and participate in school and home, and become active decision makers in their child's education. Lastly, my references that were used in the curriculum paper and PowerPoint. And this concludes my presentation.